I'm Robin Smith at the 5th International Vatican Conference, and with us today is Roy Schoenberg, President and co-CEO of Amwell. Welcome.
Thank you, Robin. Thank you for having me.
You know, in medicine, we have such siloed conferences, very unidimensional. Why do you think it's important to have a conference like this that looks at the mind, body, and soul and has so many different stakeholders?
You know, I'll be the first one to admit that, in medicine, we focus very obsessively about care, about medications, about delivery, about protocols. We always think from the clinician perspective about what can we improve on the care that's being delivered. And we tend to forget, and that's something that we do often and very, very frequently, we tend to forget the experience that as people we have when those cures are being rendered to us, when care is being delivered to us. And I think the opportunity and actually the need to begin to have the conversation, how do people experience healthcare? How can we make that experience, which is often unfortunate when you have to go through it, how can that be improved? And sometimes the answer is not a new kind of medication and not a new kind of a treatment, but rather a more holistic understanding on what matters to people. The people perspective is something that unfortunately sometimes we forget when we run towards new medications and new care models.
And certainly technology and innovation and what you're doing, bringing medicine to the home, is critical for patients and their experience. You know, we heard this morning from Sanjay Gupta. He was saying that in February of 2020, at the hospital he's at, they had 800 telemedicine visits a day, and now they're up to 80,000. It's just an extraordinary increase. What do you think when the pandemic ends? Will that trend continue? Will it change?
Well, first of all, we tend to forget that as patients, I don't know, when I'm sick, I want to be home. I don't want to go anywhere. So that is a fundamental truism that is driving some of the adoption of telehealth. But I think the other part that we need to remember is during telehealth, everybody was locked up at their home. And both clinicians and patients resorted to telehealth in order to allow themselves to get with one another. What we tend to forget is that even after COVID is over, there is a huge population of people who are locked in their home because of their age, because of their chronic conditions, because of their inability to get out of bed, that require tremendous amount of care. And the same solutions that were proven to work so well during COVID can actually liberate them, can allow them to have a much more favorable way of interacting with the care that they need. And usually what that translates also is to better compliance, better healthy behaviors, better ability to detect things that, when they go wrong and react to them and provide the right guidance and the right, treatment alterations. That population that historically, was always asked to come to where healthcare was, can now expect to have a completely different kind of healthcare experience because of the lessons that we've learned during COVID.
And, also when you look at being in the hospital, so sort of the acute care, that you have those nosocomial infections, right? The infections you have for being there longer than you may need to be. Should this allow us to get people out of the hospital sooner? And have you actually seen decreases in length of stays?
I think without a doubt. I mean, the length of stay, which is the financial arch nemesis of healthcare, that's where most of the money gets spent, I think is going to be impacted directly and dramatically by our ability to reimagine where patients need to be in order to get care. It's as simple as that. Part of it is the financial upside of allowing patients to be discharged earlier from the hospital after surgery, because we know that through technology, we can actually continue to round on them at home, every maybe even a couple of hours to check up on them for a couple of minutes. But it's not only that, it's the fact that when we think about aging, which is an hopefully inevitable part of everybody's life, if we are able to build healthcare around our home, we can age there. We can age and be reassured that where we want to be is where healthcare is going to come and surround us. Now, obviously, that means that we don't have to necessarily mobilize patients into skilled nursing facilities. We don't have to get them in and out of hospitals with all of the bad things that you just mentioned, including the mobilization of patients and terrible things happen there. We have the opportunity to reimagine where healthcare happens. That dawned on everybody in the last year.
Well, certainly connectivity and communication and this new ability is really going to change healthcare for the better. And we really appreciate your being with us today at the conference, and wish you luck and look forward to 5 years from now to see how this really transforms. Thank you.
Thank you. Thank you for having me.